these orders are meant to do. We're now at a point in the United States where we're seeing similar infection numbers that Italy was at just 2 weeks ago. So I can't overemphasize enough how critical it is for us to do these kinds of lockdown measures to keep our residents safe. I would also mention that this morning there was a cyber attack on the U.S. Department of Health and Human Services. This is very alarming to us. Just last week, I formed a cybersecurity task force in Oakland County to make sure that we were protected and our local communities are protected. But this adds just an additional threat to the disease that we're fighting and to the times that we're in. Industry experts indicate that there's a 1 in 3 chance that an organization will experience a data breach. And so we understand, as we're working with all of our community and statewide partners, that keeping our data secure is going to be a critical task as we move forward. We know that ransomware is on the rise, and we have to be on guard for that. Luckily, there have been no confirmed ransomware-related cases to date in Oakland County, but we're going to stay on the cutting edge of that to make sure that continues. I also want you to know that after this press conference, I'm going to be meeting with the other Big Four leaders down in Detroit, and we're going to also be joined by the CEOs of the major healthcare systems so that we can better coordinate our response, and that includes things like drive-through testing sites. We want to make sure that our entire region is coordinated medically to make sure that we're being as proactive and efficient as we can as we get more and more of our residents tested. We know that as more testing happens, more cases of positive individuals will happen, and we need to make sure that we're coordinated as well as we can. So like I said, I'll be meeting with the Big Four leaders right after this. Just know that we're doing everything that we can to protect our citizens in Southeast Michigan and Oakland County and across the state. Now, here to talk a little bit more about the enforcement perspective from a county perspective is our sheriff, Mike Bouchard.
Thank you, Dave. Well, thank you all for being here. Obviously, this is a critical issue for all of us to address collectively, not just in different levels of government, but as society. And a big part of that is willing participation on behalf of its citizenry. So first and foremost, I wanted to update you. I just got off a call with Homeland Security. We are working through processes with all our public safety partners across the country on different processes and procedures that relates to arrests, citizen contact, PPE, personal protection equipment, the kinds of things that relate to jail intake or prison transfer of movements. All of those things are all part of this equation. So that is a big part that's going on. Is the county executive said there was an attack on a website, and not surprisingly, we've also seen, so be alert to the fact a lot of different websites have cropped up that mirror legit sites, and they are putting Trojan viruses into computers. If you click the link, there's one specifically related to Johns Hopkins, which is a real-time sickness map, and there's a very close similar kind of site that actually is planting malware on your computer. So be aware of those kinds of things. Don't click on a link that you don't know what it is when you get an email or when somebody says you should go to this site. Make sure you verify it independently. And then specifically to the point the executive raised about venues, as this list grows, as the governor or the county executive declare different restrictions, be it restaurants or venues, we'll probably get the call in law enforcement, but we're not planning to go out and arrest people. You know, we plan to go and verify that in fact there is a non-compliance with an existing order, notify the establishment of that, write a report which will be forwarded to the health department. We're not looking to arrest people in this situation. We're looking to protect people, inform them, and guide them, and be a part of the solution. And that's what I would say to everybody. Help your neighbors, make phone calls to the elderly, those at risk, do the right things in this situation, quit hoarding things that you don't need an excess amount, which prevents your neighbors maybe from getting it. You want them to take the same precautions that you're taking, otherwise now you're exposing yourself to them should they become infected. So work together is a much more positive path, and we'll get through this. You know, I responded to Ground Zero and to Katrina, huge tragedies, and we saw the best of humanity and the worst. but the best is what overcame those problems, and it will here. We will get through this as long as we work together. Now, I guess I get to introduce our proprietor. Dean, thank you. This is a proprietor of the restaurant. Obviously one of our concerns is the impact on small business, so thank you for hosting.
Thank you, Sheriff. Wow. I always dreamed this would be an announcement to sign a big contract with the Tigers or something cool like that. Obviously, us as owners have a lot of concerns, a lot of challenges facing us. I can tell you I speak for a lot of business owners in the restaurant industry. Our priority is our staff's well-being and our customers' well-being. And over the last several weeks, we've heard our staff talk. We've held off on making decisions on closing ourselves, and I believe that this is the right thing for the governor to do, so that it takes the decision out of our hands and that our staff can go home and worry about their families at this point. The challenges that we have, paying the bills, utilities, mortgages, insurance, all these things we still have to pay. I don't know how long we're going to have to be closed, but we have to go home as owners and try to figure out exactly how this is going to work for us and what our options are going to be, whether it be an SBA assistance or an insurance claim of some sort. But those, I believe, are going to be out there for us. The Ferndale DDA is part of the Main Street program in Oakland County. The Ferndale DDA has been really good about getting out to the business owners, giving us links to the SBA, giving us information as to what's out there to help us, what we can do to try to mitigate the loss that we're going to have, and what we can do moving forward to keep our businesses going. Right now we're kind of being forced into a situation where we're on vacation. Doing things like carry out and delivery, gift card sales are all good things. The places that do carry out and known for it, you should continue to support them. Same thing with businesses that do delivery. Support those folks. They're going to need it. People like us that we don't really are not known for that, and my particular businesses, I think we'll keep our doors closed and let the people that handle those things as a specialty service handle it, but don't let that dissuade you from going to carry out to your favorite restaurant and help supporting them if they decide to open in this time. We're all in this together. We have a lot to think about. We have a lot of new challenges to face. This is unprecedented territory. Restaurant owners have never thought about this before. I can guarantee it. I've talked to many through Facebook and on the telephone, and there's a sense of relief that this is happening right now, and I think we'll get through it. All we can do is all we can do. We want to make sure that our staff is safe and that our customers are safe. So wash your hands and let's get through this together. That's all I really have to say right now. This is again trying times for everybody. The restaurant industry works on really slim margins. We've got a challenge ahead of us, and hopefully we get through it.
Could you please pronounce and spell your name?
My name is Dean Bach, DEANBACH. You're welcome. And at this point, I really have not much else to say. I get the honor to introduce Congressman Andy Levin.
Yes, sir.
All right.
Thanks, Dean.
Thank you.
Dean, do you have gift cards?
We do have gift cards.
All right. I'm buying a $100 gift card, and in happier times, Mary and I are going to come back here, and we're going to celebrate your reopening, whenever that is. I want to start by thanking all the folks up here for the great work they're doing, and particularly Governor Whitmer and County Executive Coulter for being ahead of the curve on making the tough decisions required to keep us all safe and try to flatten out the curve of this pandemic. I also want to start just on a personal level. All of you who are hearing this, we up here and you are just all people trying to deal with something that's scary and that has a lot of uncertainty to it. I've got a dad who's 88, an uncle who's 85. My mother-in-law's 88. Two of our kids have Crohn's disease, so they are immunocompromised, and they're young adults out in the world. So, how to try to reel them in and keep them safe. And then I've got a school-age daughter whose school is closed. Every one of you has situations like this. And so I just urge you to prioritize your own personal safety and your family's safety. If we all dial back and keep our social distance, wash our hands, sanitizers, clean all those surfaces, you're taking care of yourself, but you're also reducing the risk for all of your neighbors. Do go outside. But, parents, if you got little kids and the playground equipment is used by a lot of kids, that's probably not the greatest idea. Everybody can take a walk. Everybody can go out, in the woods or wherever, whatever space that's not crowded that you have access to. I want you to know that our office in D.C. and my district office here in Warren are moving to telework or have moved to telework, but we are 100% available to you. I want you to call us. I want you to email us. Go to our website if you have any concerns, problems with the federal government, or frankly, if you just want to talk. We are there for you to talk to you, and our staff is 100% engaged. On the federal level, first of all, a couple weeks ago, we passed $8.3 billion of all new funding to basically support and turbocharge the public health response to this, directly, the public health response. Research into a vaccine, cures, and testing. Direct support for for state and local public health departments, and so forth. And then on Saturday night at 12:30 in the morning, Saturday morning at 12:30 a.m., we passed the Families First Coronavirus Response Act. And that is all about helping people most affected by this crisis. So a couple of the top line pieces of it. Number one, for anybody who needs to be tested, I'm not urging everybody who has a sniffle to run out and get tested. If you're exposed or you have real symptoms, you need to be tested without regard to worrying about cost or any other status you have. So through all the different funding streams, from someone who's uninsured to Medicare to a veteran to private health insurance, every single one, testing will be completely free and available to everybody. The second thing is, what happens if you're laid off? What happens if you need to stay home for the sake of everybody else? We loosened the restrictions and provided funding for paid sick leave and paid emergency leave for everybody in this country. It runs through the end of the year, and for all small and medium-sized employers. Larger employers are generally providing this on their own. Thirdly, we enhance unemployment insurance in multiple ways to make sure that everybody affected can get unemployment insurance, including people who, there's a lot of different specific situations. We tried to cover every single one. For example, someone who's exhausted their benefits, or someone who's self-employed, and all these different things. Food security for seniors, for kids, for pregnant moms and infants. We greatly expanded the funding and cut through all the red tape so that everybody can immediately get assistance. For example, people can get put on their EBT card funding if there's a school kid on public lunch, and we'll just give it directly to the parents so that they can feed their kid with added funding. And finally, health security. We changed the FMAP situation so that the states will have adequate funding. There's a real concern that states might dial back on providing for people who've been eligible for Medicaid or expanded Medicaid, like the Healthy Michigan program here in Michigan. We provided funding for that. So we're really aggressive about this. And then we'll come back in the coming weeks and take a third step for people like Dean. Make sure we already, by the way, in the first bill 2 weeks ago, we greatly expanded the program for low-interest loans for businesses, so that's rolling out. But we know we'll need to do more to prevent a huge recession or even depression in this country. We're bound and determined to prevent that with whatever we need to do. So we'll come back to that. And then quickly, a couple things unrelated to those that I've done personally. One is I introduced legislation to require OSHA to put out an emergency standard to protect frontline healthcare workers in this situation. OSHA should be acting immediately to make sure that workers are protected, EMTs, folks in hospitals, folks in nursing homes, and so forth. And then secondly, another highlight is I found out recently that the president has authority under the Defense Production Act of 1950 to deal with public health emergencies. And he can call in the CEOs of testing companies, of the companies that make the gowns, of the companies that make the respirators, and to order them to make what we need right now. And I urge, within 90 minutes, I got 57 co-signers on that letter. That's all I had. It was the end of the day Friday. We would have gotten hundreds. So I'm urging the president to invoke the Defense Production Act, and I can talk to people who are interested in the details of that later. But for now, I just want to end by, again, commending all of our leaders, and I'm going to single out one other one because I get to introduce her. Really, our Attorney General has been so out front in protecting the citizens in this situation and so many others. So I thank her, and I call her to the microphone, our great Attorney General, Dana Nessel.
Thank you, Congressman Levin. I do want to say that this seems Executive Coulter, thank you so much for inviting me, but it seems particularly cruel on the day that we're talking about the closure of bars to be so close to all these delicious beers that you have at your establishment here, Dean. But obviously this is for the greater good, and there's a very important reason that the governor issued that important order. I do want to dovetail on what Congressman Levin said, in that obviously the federal government is working very hard to try to allay the financial concerns that so many people have, and of course the health concerns. I will say just yesterday I spoke with Representatives Slotkin, Stevens, and Dingell, and there is a coordinated effort between the state and the federal government in terms of providing relief to Michigan residents. So we are working in lockstep together on that. In regard to the governor's order from this morning, closing so many different types of establishments, obviously we understand that this is a tremendous hardship for tens of thousands of businesses around this state, hundreds of thousands of employees and workers. And again, obviously, there is a concerted effort to provide relief to these workers, and I will say that just moments ago, I believe the governor issued a new executive order that extends unemployment benefits and also expands those who would be eligible for those unemployment benefits, and most of you probably just got that into your email boxes from the press release. But that being the case, we do have to make certain that we are enforcing the governor's many executive orders for the health and safety of the public. This does not work unless we all work together on it. And so what our office is doing is we're working together, we're coordinating with local, county, and state partners, as well as state regulatory agencies, in the event that we see any violations of the governor's executive orders. And we do ask people to contact our office at the Department of Attorney General for that. We are very sympathetic to the many people who are affected by this, but we have to make sure that people are not congregating and that the businesses that have been ordered to close remain closed. But of course, we, as Dean indicated, we urge people to frequent these businesses to the extent they can. If you can afford it, get takeout, get delivery. Make sure you tip your servers the same way you would if you were dining in. All of us really need to pull together to take on this challenge, but we are going to be aggressive in terms of enforcement as well. So contact us at the Department of Attorney General if you see any violations of the governor's orders. Few other things that I want to discuss. I just want to reiterate what we talked about at our press conference yesterday in Lansing regarding price gouging. Again, the new executive order that came down from the governor yesterday is that no one who has acquired any product from a retailer shall resell that product in this state for a price that is grossly in excess of the purchase price at which they bought that product. And no one shall offer for sale or sell any product in this state at a price that is more than 20% higher than what the person offered or charged for that product as of March 9th of 2020, unless that person can demonstrate that the price increase is attributable to an increase in the cost of bringing that product to market. And remember, this is a crime now in order to price gouge. Before, it was simply a violation of the Consumer Protection Act, which was a civil offense. It is now a criminal offense. And we are focused specifically on products related to the epidemic, face masks, cleaning products, hand sanitizer, bottled water, food items that are high in demand at this point. And I would like everyone to contact us in the event that you see any price gouging anywhere. Please contact us at the Department of Attorney General, pardon me while I look for the specific number for you. 877-765-8388, or you can contact us online, michigan.gov/AG complaints. I will tell you that we have dozens of complaints that we are currently investigating just from the last 24 hours. But we are going to continue to go full force on this to ensure that the public is protected, not just from a public safety measure, but also from an economic standpoint. We will not permit price gouging. One last thing I want to discuss, and that is COVID-19 related scams that we are seeing. And the sheriff touched on this, but what we are seeing specifically is that people are receiving phone calls, particularly we're seeing seniors that are targeted, and we have individuals who are offering to provide testing to them, but they have to prepay for it, and then they're asked to provide their financial information. And what I would say is this: if you are an individual who has not reached out to anyone, and you receive a phone call or you receive an email or a text message asking for your financial information, please do not provide your financial information to anybody that you have not reached out to. Do not give them your Social Security number. Do not give them your credit card. And, you know, in the event that you receive a call, I want everyone to be mindful of something called spoofing, where somebody can call and make it appear as though they're calling from a health department or they're calling from a hospital. If somebody calls you and says that one of your loved ones has been taken to the emergency room with symptoms of coronavirus and that you need to provide your information to help pay for the expense, do not do it. Do not fall for it. It is not legitimate. It is a scam if someone is trying to obtain your financial information. And again, if that does happen to you, please make sure to contact us at the Department of Attorney General and report it immediately, and we will act on it as quickly as possible. So with that, stay safe, stay healthy, everyone. And at this time, I would like to introduce Oakland County Commissioner Chair Dave Woodard.
Thank you. Thank you, Attorney General Nessel, for your leadership. Especially thank you to Dean for not only hosting this, but being a great spokesperson. The reason we're here, the culmination of one of the most recent executive orders of shutting down all restaurants, it is important to underscore the anxiety and the financial hit that is to local business owners and workers. And over the weekend, I've been spending a lot of time talking to them, restaurants that already bought inventory, workers who are counting on paychecks and tips to be able to pay the bills. And we have to definitely continue to be vigilant to provide all the support necessary, working with all of our partners to bring those things forth. On behalf of the county board and the governing body of Oakland County, I want to assure that we are prepared to do everything, anything to guarantee the safety of the public, protect all of our employees, and continue to support the Executive Coulter in his efforts to do everything to flatten the curve. And we will be meeting this week under the advisement of the governor's executive order on how to comply with social distancing, while also making it possible for the public to participate, because there are important actions to take, actions that are necessary to make sure that our executive has the full power necessary to respond quickly to address this crisis, in addition to advancing policies to ensure paid sick time now into all of our employees, extra emergency sick time to all of our employees, but hoping that the broader business community is going to step up, because this is absolutely critical as we go into in this period of time. The other thing I would just mention that the board has already stepped up. Oakland County is putting additional dollars towards this effort. I will be asking the board to consider an additional $1 million appropriation to support these efforts. Let me make very clear that we will be working with our federal partners to make certain that every grant, all federal grants and federal resources, we will be seeking to reimburse for all the costs that we possibly can as we address this. We also know that we need to have resources available now to respond. And so we are prepared to do that, and we'll be taking action later this week. Without any further ado, I will hand it over back to Executive Coulter to ask for any questions.
Well, thank you, Dave. And Dean, thank you again for hosting us at Embrew here in Ferndale. The mayor of Ferndale, Melanie Piana, is also here. Thank you for hosting us in Ferndale. And now at this point, if there's any questions. Yeah.
We're hearing about bars, restaurants, theaters, gyms. What about these people working in these factories? A lot of people are wondering, why is that still allowed to happen? That's way more than 50 people.
Right now, the governor's order is at 250 for her original order. I think that they continue to reevaluate those numbers. Right now, we're asking on the business communities. The business community has not been shut down, but we're asking them to take a very hard look at their operations, which they know better than anyone, and if there's potential for gatherings larger than that they should consider taking the necessary steps. A number of businesses have done that, and I think we'll continue to work through that throughout the day and week.
In that executive order, spas, does that include salons, nail places, things of that nature for those businesses that are wondering, do they need to comply as well?
Do we have, maybe I'll ask the Attorney General.
Yeah,
who is-
I mean, the specific order does not elaborate on spas, but I would say that it seems pretty apparent what the intent of this order is. And of course, if you have individuals that are going to be close in contact with one another, as I would think necessarily, of course, they have to be under those circumstances, that they be covered. But what I'm going to do right now is I'm going to contact my office for a legal opinion on that, so I can make certain that I'm giving you the proper information, because it's not specified in the order. It does say spas, and it does not say nail salons. It does not say barbers or anything of that nature. So I'm going to find out and get right back to you.
But I would just say to businesses that haven't been specifically called out, that you should pay attention to the CDC recommended guideline of 50 people. You should pay attention to the 6 feet distance. And if you don't think you can keep your employees or customers safe from that, then I would encourage you to take voluntary actions now before further ones are necessary.
I was going to ask, shopping malls is another question we're getting from people already online, so I'm assuming that's another one that's a TBD as far as clarification.
We'll look into that. Thank you. Yeah.
All of us still see a lot of people saying it's an overreaction, it's a panic move, etc. Appreciating everything that everybody has said today and what continues to be cascaded down. What would you say specifically to those people who still aren't concerned?
That you need to be concerned. And if in 2 weeks or 3 weeks they say, oh, you overreacted, I think everyone here would agree with me that that was the wise and prudent thing to do at this moment. As I started by saying, we now have the level of infections that Italy had 2 weeks ago. I don't think we can take this seriously enough. I think we are taking it very seriously. And I hope people think it's an overreaction 2 weeks ago, because that means we did a better job of flattening the curve. It's spiking now, and now is the time for action to save lives.
Dean, if you could, I know you don't speak for all small businesses, but when we're talking about those options for loans and things of that nature, how long are you able to currently pay your employees before you have to start going to that kind of situation?
Most of us in this industry don't have deep bank accounts. With small businesses, small reserves, and we run on very tight margins. So the answer is I don't know. It might not be past today Right now, I'm telling all the staff to stay home. I'll get with them tomorrow. We'll have a meeting so I can give them some options, whether it's state assistance through unemployment or the SBA assistance. But right now, I got to imagine that most people in my position are wondering the same thing. How are we going to pay a staff that counts on a paycheck every week?
Congressman, may I ask you something? Trying to keep it apolitical and understanding people are looking forward, but when it comes to medical equipment and when it comes to what some still continue to say is disinformation from the president, not to tee you up to go after that, but I'm just curious about the concerns about the information we continue to receive or not receive, and in regard to whether we are still not doing everything we can to get supplies to people who need them.
Well, I don't want to sort of relitigate the past. There will be plenty of time for that. We need to support this administration to succeed in this because, as the county executive said, flattening the curve now will save thousands, tens of thousands, hundreds of thousands of lives potentially. So we just have to all work together as best we can. I am just trying to do my best to contribute to the most robust response possible. That's, for example, why I called on the president to invoke the Defense Production Act. So we're all trying to contribute to the most effective response possible. And I think what we see in terms of conflicting accounts and different information coming from different places within the administration, it is what it is. It's not something new. And I think we all just need to work together with the health professionals, the public health professionals in the administration who do understand this and know what to do to try to have the most effective response possible. And that's what we're going to do.
Other questions?
Going back to the executive order, what sort of penalties would a small business who refuses to comply would we be looking at here?
Is that, let's hand that one to you, or is that an AG question? Yeah. Yeah.
So now, in terms of a regulated business that involves somebody who has a license from the state, obviously you're looking at a suspension of their license or a revocation of their license in the event that they violate the executive order. For unregulated businesses, it's a misdemeanor offense. So the proprietor of that business can be criminally charged with a misdemeanor offense.
So perhaps a bar that was refusing to close could lose their liquor license?
That's correct. And the Liquor Control Commission is going to be paying close attention to this.
Other questions? All right, we appreciate your time today. Thanks so much.
Thank you.